Well, hi there, and welcome to Time to Talk Traumatic Brain Injury, the podcast for survivors for the entire brain injury community, helping you make a more productive, healthy, and happy life. Well, today on Time to Talk Traumatic Brain Injury, we have a very serious topic to talk about, and we have a real advocate that's going to stand by her word. Let's learn all about it today. In Canada, acquired brain injuries, both traumatic and non-traumatic, occur at a rate of 44 times higher than spinal cord injuries, 30 times more common than breast cancer, and a staggering 400 times more prevalent than HIV/AIDS. Shockingly, the incidence and prevalence of brain injuries surpass the combined numbers of HIV/AIDS, spinal cord injury, breast cancer, and multiple sclerosis. Actually, over 165,000 Canadians endured traumatic brain injuries, contributing to a national prevalence exceeding 1.5 million cases brain injury in Canada. Yet the figure falls short, and it excludes unreported cases resulting from concussions, intimate partner violence, homelessness, incarceration combat, and substance-related incidents. While acknowledging your government's significant healthcare investments, I emphasize that addressing brain injury goes beyond healthcare. Despite provinces and territories meeting healthcare criteria, the current state of brain injury services and support across the country is marked by fragmentation, isolation, and chronic underfunding. I implore Canada's leaders to recognize the critical imperative for a comprehensive national strategy encompassing brain injury awareness, prevention, treatment, and holistic recovery. This is just not a health concern. It is a pressing national crisis that demands immediate attention and action. Please act today. Today at the Clubhouse, we are lucky enough to be joined by the woman who said these words and is working very hard and diligently at this important campaign. This wonderful woman's name is Danielle Breeze-Biglione, the founder and CEO of CGB Center for Traumatic Life Losses. Danielle is a registered professional counselor and master practitioner in clinical counseling. She is the widow of Constable Jerry Breeze. She specializes in traumatic life losses arising from death or catastrophic injury. And today she has something very, very important to talk about: dealing with brain injury. Danielle was speaking at a news conference in October of this year in support of Private Members Bill C-277, the National Strategy on Brain Injuries Act, which was introduced by Alistair McGregor, MP for Cowichan-Malahat-Langford. On October 25th in Ottawa, Alison McGregor, MP for Cowichan-Malahat and Langford, held a news conference calling on the government to support his Private Members Bill C-277, the National Strategy on Brain Injuries Act. Bill C-277 calls for a national strategy on brain injuries that aims to support the more than 1.5 million Canadians who are suffering from a brain injury. The national strategy for Bill C-277 indicates that the Minister of Health must, in consultation with representatives of the provincial governments responsible for health, Indigenous groups, and relevant stakeholders, develop a national strategy to support and improve brain injury awareness, prevention, and treatment, as well as rehabilitation and recovery of persons living with brain injury. Okay, and we have actual Danielle here for us in our Blue Sheet studio. How are you doing today, Danielle?
I'm great. Nice
That's
to be
good.
here, Greg.
It's lovely to see you. Danielle, can you please tell me why the passing of Bill C-277 is such an important step in moving forward with the brain injury community?
Certainly. So Bill C-277 is calling upon the federal government to establish a national strategy on brain injury act in Canada. And what it will do is provide a North Star guidance for the country. We don't have a national strategy. We've never had a national strategy on brain injury. And what this does is provide that guidance across the provinces and the territories to say, this is what the service provision should look like. This is what people's needs are in their community. These are research priorities. This is education and training that's needed across the country. So it will help to standardize some of those asks that we have across the country. It'll also help to bring about some common messaging for prevention and awareness, the education and training that can be utilized with first responders, doctors, nurses, support workers. What are the things that are needed, and as well, it provides a guideline as to what the cares are that people will need in their community. So what we'll do is each province, each territory will then take those guidelines and massage them
Right.
for their
their
unique
specific demographic.
population and demographics,
Okay.
as well as in the territories, right? So the whole idea behind it was I never believed that BC should tell Ontario what's best for them, and Ontario cannot tell the Yukon what's best for them.
No.
Everybody needs to be at the table. So a national strategy brings us all together to collaborate on what the needs are for Canadians across the country.
And what's interesting is I was reading about the strategy, and the strategies must include measures designed to lots of things: promote implementation, identify the training, education, and guidance needs, promote research, promote information, create national guidelines, promote awareness and education, foster collaboration, encourage consultation, identify challenges and resulting from brain injuries, maintain in collaboration with Brain Injury Canada, and establish a task force to include policymakers. So there's lots of different things that the strategies include.
Definitely, and the most important one is that it will include people with lived experience, right? So
Yes.
individuals who live with a brain injury, family members who are supporting a loved one, caregivers, family, friends, all of that. So that's the most important part, because for all of us coming to the table for conversation, it's realizing that this has to be collaboration with people who are living this experience. And it's not a top-down approach where we're going to say, this is what's best for you as a survivor of brain injury, this is what's best for the family. It's about meeting the families and individuals where they're at and collaborating on what the individual needs are.
So the strategies will be different depending on what the person needs, or what the...
Well, yeah, there'll be overarching guidelines, right? As what are the rights of an individual with brain injury and the supports and services that they need. And then just like we do here in Victoria, and the CRIDGE does, and Victoria Brain Injury Society does, you have to have that flexibility to take those strategies and customize them to your client and to the family.
Okay. There is a name that was very interesting in my reading. Her name is Shirley Wilson, and she's now going to be part of the grassroots program. Why is Shirley Wilson such an important piece of this campaign?
Well, I came upon Shirley's story last year before I went to Ottawa and reached out to her. So she is an Abbotsford School Board trustee, and her son, Jacob, had sustained a brain injury when he was hit by a car and really left for dead in the middle of the road, and suffered a traumatic brain injury. And he had quite a journey in recovery, but he wasn't able to access the services and supports that he needed as his mental health started to spiral downwards, and then he went into an addictive cycle. And by the time he was really desperate for help, he was high in addiction use, and his mental health was really challenging. And he had been in the hospital twice in 48 hours and was discharged the second time without his mom knowing. But he was an adult, so they're not going to notify the mom, but she didn't know. And the next call she got was that he had accidentally overdosed. So that is a death that was preventable. Like, Jacob should be here today. And so I reached out to Shirley and I said, this is an important part of the work that we're doing here in British Columbia on the BC Consensus on Brain Injury, Mental Health and Addiction, but it's also an important story for Canadians to know that if we don't do things differently, we will have more stories like Shirley Wilson, and we'll lose more Jacobs in the world. And, what I've been working hard at is getting policymakers to see that brain injury lives in the forefront of mental health and addictions, and it lives in the aftermath. It lives in the forefront of homelessness. It lives in the aftermath. It lives in the forefront of incarceration. It lives in the aftermath. And if we would stop being so reactive to, to put Band-Aids on these challenges individually and come together and
Band-Aids we need.
Yeah, back up the bus and let's look at how people are getting there in the first place and start to serve them in the way that they need, and those numbers would be reduced.
And now this is 125 days. Tell us a little bit more about the 125-day campaign.
Yeah, so 125 days. When I went to Ottawa in October, we did a national press conference. We went to the question period. We hosted a reception for MPs, and I had a strategy meeting with my MP, Alistair McGregor, who's put forward the bill. So I've been working with Alistair for 7 years on this to bring it to this point. And I said, okay, what are the next steps? What's the next thing that I can do to help move this forward? Because because what people don't understand is like a private member's bill really sits in a lottery, right? So there isn't, okay, it was read in June 2022. That means second reading has to happen by this date. It doesn't happen that way. It's in a lottery. It's got to get pulled forward. It's got to be debated. So we're up for second reading. So I said, how can we help to move this forward? So Alistair said to me, really, it's the stories. Like he said, you've got to mobilize people because that's what's going to turn heads. So on my flight back from Ottawa, I was with my grandson, and I, just started thinking, like, what can I do? And I thought about the Canada 150 project I did when Canada turned 150 years old. I posted a new picture of a survivor of brain injury every day for 150 days to raise awareness in Canada of Canadians who are living with the impact of brain injury. And I thought I could do something like that. So when I looked at when the House of Commons is sitting in Ottawa, they sit for 125 days from January 29th to December 17th in 2024. 125 days. In between those 125 days, your MPs are home in their constituencies talking to people like me and you and who vote for them. But they're in Ottawa and expected to be there for those 125 days. And that's where the business of, government takes place during that time. Mm-hmm. So I came up with the idea for 125 days to say yes campaign, meaning that they have 125 days to make this law in Canada that a national strategy will happen. So every day of those 125 days, I have a list of 75 people that are being emailed, and 38 in that list are getting printed letters as well, mailed to the House of Commons. These are targeted members of parliament, because we have like over 300 MPs. So these are a targeted group, high-level officials that, we're reaching out to say, please support Bill C-277 and bring it forward. So on every one of those 125 days, they get a new photo of a survivor or family member and a video clip of the individual telling, who they are, where they live, who their MP is, and that they live with brain injury or they're supporting someone with brain injury. And then that is also posted on our social media. Mm-hmm. And so to date, we're on a break this week. MPs are home in their home office, so we're on a break. But as of Friday, I had sent out 975 emails and mailed 570 letters to the House of Commons. So they
should have a definite impact.
Should have an impact. By the end of the year, I will have sent about almost 5,000 letters.
Wow. Is there anything more the brain injury community could do to help support this and even?
Yeah, absolutely. Because the biggest thing is your MP is not beholden to me. He has no obligation, he or she has no obligation to respond to what I'm asking, but they do to you as a constituent. So I'm encouraging everybody to go to the BC Consensus on BrainInjury.com website. On the right-hand side, you'll see a red bar that says National Strategy for Brain Injury. Go on there, it'll tell you all about it. But you can download a letter to your MP. I have an English version and a French version right on that page. Download it, put your name in there, who your MP is. It is all customized to give the information, and then either make an appointment to see your MP and take it right to him, or you can email it to them. And if anybody wants their email, just contact me, but you can find it right on the House of Commons website, and also you can mail it to the House of Commons, and there's no postage required to mail letters to your MP if it's going to Ottawa. And that would be the biggest help. One, if you want to be involved in the campaign and you're a survivor or family member, get in touch with me and we'll get a video and a photo of you. But anybody and everybody should be downloading and sending that letter to their member of parliament.
The more we have, the more impact we have.
Yeah, the more we have. Yeah.
Well, thank you very much, Danielle. That's kind of you.
Well, thank you. I appreciate your interest.
My pleasure.
Thank you.
I want to thank Danielle very much for being here today with us to talk about Bill C-277. It's so important. If you want to find out more information, go to the BC Consensus on Brain Injury website at bcconsensusonbraininjury.com and find out how you can get involved and even more about this act. So take good care of yourself, and we'll look forward to talking to you in a couple weeks with another good, informative, and fun podcast. Take good care. Bye-bye.